Good afternoon. My name is Laura Jacobs, and I am the Education and Outreach Coordinator for the Brain Injury Alliance of New Jersey. We are excited to have Winifred Mercado Hudes present today's webinar titled The Role of Medical Nutrition Therapy Following Traumatic Brain Injury. But before I introduce Winifred, I would like to mention a few things about BIANJ's upcoming events. First of all, this webinar will be available on our website, bianj.org, after today's airing. And at the end of today's webinar, I will tell you how you can receive a certificate of attendance. So our upcoming events, the first is on Monday. We will be having a webinar on senior safety, preventing falls while staying in the home, exercise for healthy bones and muscle, and keeping our brains strong and connected through technology for the generations that did not go to school owning a cell phone. That is on Monday at 10 a.m. You can register on our website at bianj.org, or you can email me, ljacobs, that's ljacobs at bianj.org, or I will send you the link to register. And that will be at the end of this webinar. You can find that information also. Secondly, I am very excited to let you know that our upcoming first time ever virtual annual seminar titled A 2020 Perspective, Improving TBI Outcomes in the Next Decade, which will be held on May 12th from 9 a.m. to 3 p.m. Eastern Standard Time. You will still be able to learn from experts in the field, ask questions, and interact with fellow attendees, and earn CEUs, while attending workshops on the latest in TBI clinical care and research, such as sleep, aging, medical
Okay, so let me just give a little bit of information about brain injury in general. Brain injury is an insult to the brain, which causes damage. It can be severe, moderate, or even mild. There are acquired brain injuries like strokes, aneurysms, brain tumors, and traumatic brain injury. And traumatic brain injury is an impact to the head that disrupts the normal function of the brain. The severity can range from mild to severe, and this also includes mild trauma like concussions. So traumatic brain injury can be caused by falls, motor vehicle accidents, really anything that your head is being struck by or against. And while the causes may differ between incident of brain injury, the effects on a person's life can be quite similar. So according to the CDC in 2014, there were approximately 2.87 million TBI-related emergency department visits, hospitalizations, and deaths, which occurred in the United States. About 75% of TBI cases in the United States are mild with complete recovery. So what are the results of a brain injury? In many cases, it can be full recovery. But in some cases, it can lead to damage. The damage can be transient, short-term, long-term, or permanent. It can lead to deficits in cognitive executive function, like memory loss, decision-making difficulty, judgment deficit, impulsivity control, and planning difficulty. In some cases, it can lead to disability and reliance on a caregiver for activities of daily living, ADLs. Activities of daily living can include eating, bathing, dressing, toileting, mobility, and grooming. And it can also lead to needing assistance in the instrumental ADLs, which are more complex in nature. Like, can a person grocery shop on their own or housekeep on their own? Can they manage their money? Can they prepare their own food or use a telephone and transportation? So when a patient experiences brain injury, this is considered the primary incident. The consequences of that primary incident can then lead to a secondary injury cascade effect, and this needs to be medically managed in the hospital. The following can all be part of that secondary injury cascade, and you can see I've written here on the slide that second injury cascade can be hypertension, hypoxia, brain edema, cerebral vasospasm, oxidative stress, which can lead to damage, elevated intracranial pressure, opportunistic infection, and hyper and hypoglycemia. So there are various medical treatments, and they're all really very important to help minimize any long-term damage and promote healing. But when it comes to nutritional considerations in the ICU or the neuro ICU and working with patients with brain injury, it's important to take into consideration the following. Is the patient a surgical patient? What medications is the patient on? Many brain injury patients require sedatives or paralytics, which can lead to gastrointestinal slowdown or distress. Some patients are on propofol, which is a sedative, which can decrease brain activity. It can be helpful with that cerebral pressure regulation, but that propofol provides calories, and that has to all be taken into consideration when a dietitian is assessing needs. Dietitians need to be aware of any metabolic and hormone changes that can trigger a hypermetabolic state, which is characterized by hyperglycemia, proteolysis, and subsequent muscle wasting. And if the patient requires enteral nutrition, then the formula chosen for the tube feeding and the tolerance to that tube feeding need to be monitored daily. So when a patient is in the neuro ICU and being medically managed for a brain injury, often a tube feeding is needed to provide nutrients to the body. The tube feeding is the preferred route of feeding. It's best to start a tube feeding within 24 to 48 hours once the patient is hemodynamically stable. Protein needs are elevated to replete protein losses during stress following brain injury. And you can see the range on the slide. You can see the range of recommended protein can vary between 1.5 to 2.5 grams per kilogram of your body weight per day. So we have to take into consideration if the patient has any comorbidities or wounds. I have to know their current BMI or their weight status to determine exactly the amount of protein to provide in the neuro ICU. And just also knowing that this can always change with follow-ups. So energy needs, which are the calorie needs for the patient, can range greatly depending on whether a patient is on mechanical ventilation or not. It's important to manage daily what's going on with the patient to make sure they're meeting their calorie and protein needs. And in addition, fluid needs are dependent on fluid fluctuations in the neuro ICU. So fluid management is really important following a traumatic brain injury. Some medication therapies used in the neuro ICU act to pull water out of the brain tissue. So a lot of times IV hydration or free water flushes via the tube feeding are really avoided. And if enteral nutrition is not feasible, then parenteral nutrition is considered. This is also known as nutrition through the vein. A patient can receive adequate protein, calories, fats, vitamins, and minerals in a fluid mixture, completely bypassing the gastrointestinal system, and this is administered through an IV access point. So you can see the process of feeding a patient in the neuro ICU is definitely a team effort between the doctors, nurses, and dietitians to keep the patient properly nourished. So when the patient's able to begin the transition from tube feeding to oral feeding, and a lot of times what can happen is a patient comes into the hospital and then they're in the neuro ICU, and then they can transition from the neuro ICU onto like a step down floor, but still be in the neuro unit in the hospital. So when the patient's transitioning from tube feeding to oral feeding, a speech language pathologist always comes in and conducts a swallow evaluation, typically at the bedside. This evaluation helps to determine if the patient's safest, what the patient's safest swallow function is. And the speech therapist looks for signs of dysphagia, which are very common for patients with brain injury. So this slide shows the IDSI framework, which most institutions are using as a guide for dysphagia diets. And the IDSI framework stands for, the acronym is the International Dysphagia Diet Standardization Initiative. And you can see here that we look at foods on the left side, starting with like regular texture. Some patients might need soft and bite-sized or minced and moist or pureed texture transition of their food. And then we look at drinks also. So can they drink thin liquids? Do we need to slightly thicken their liquid? Does it need to be mildly thick, moderately thick, or even extremely thick? And then as we transition to oral feeding, we have to identify in the patient if there are any self-feeding challenges. And in many hospitals and certainly in rehabilitation facilities, a lot of patients are able to use adaptive feeding tools if they're able to feed themselves. In some cases, patients can't feed themselves, and so we need to make sure that we have a staff member who can feed that patient. Because it's really important to make sure that if a patient can feed themselves, it gives them that sense of independence when they're eating a meal, which can really go a long way in their recovery. So as we continue with transition to oral feeding, we're not just looking at a safe swallow or if they can feed themselves, but I'm looking at a lot of other things as well. Is the patient able to consume enough calories, protein, and fluid by mouth? Do I need to continue an enteral nutrition? In some cases, some patients are able to consume food orally, but they might not be able to consume enough calories or protein or even fluid orally to meet their overall needs. And so in many cases, we might be running that tube feed, maybe running it overnight and allowing them to eat 3 meals during the day. Do we need to recommend an oral nutrition supplement? A lot of times in the hospital, you might see dietitians recommending like Ensure or Glucerna or some kind of pudding that's providing a lot of additional calories and protein. And sometimes we might be recommending those for when they go to a rehab facility or even when they're going home. And then we're always monitoring for changes in their swallow ability and dysphagia. So a lot goes into making sure a patient meets their nutritional needs. And the reason for this is that the recovery from brain injury requires strength to participate in physical therapy, occupational therapy, and speech therapy. If a patient begins to lose weight or shows signs of malnutrition, then they may not meet their intended goals. And nutrition really plays a big role in the recovery of brain injury patients. So now let's start talking a little bit about the science of food. When we eat a meal, that meal is comprised of nutrients, macronutrients and micronutrients. We need all these nutrients on this slide to help our body function at its best. We get our calories from the macronutrients, and you can see those listed here. Our carbohydrates, our protein, and our fats. And you can see with carbohydrates, it's what we think of. It's the bread, pasta, rice, dairy, fruits, and all vegetables, not just the starchy ones, beans and legumes. Proteins, I mainly have animal protein sources listed here, but please remember that there are plenty of excellent plant protein sources that we can consume as well. And then I've listed different types of fats. And then we need our micronutrients, our vitamins and our minerals from animal and seafood sources, whole grains, fruits, and vegetables. So if we think of our bodies as a car, you can think of the macronutrients as the gas that keeps the car going, but the micronutrients are the oil and the air in the tires that make the car work more efficiently. So continuing with the science of food, phytonutrients. Phytonutrients are a substance found in certain plants which is believed to be beneficial to human health and prevent various diseases. So I've listed some examples here of different phytonutrients. These are phytonutrients that many people have heard about just in the news or reading articles. Lycopene, which is found in tomatoes, acts as an antioxidant which helps protect against cell damage. Resveratrol is found in the skin of berries and grapes. and also known to be an antioxidant and are known to have benefits in heart health. Isoflavone is found in legumes and have antioxidant and anti-inflammatory properties. And carotenoids, colorful pigments in vegetables like the tomato, are known to have health benefits like antioxidants and promote eye health. So our bodies do not necessarily need phytonutrients in the same way that we rely on macro and micronutrients, but we definitely receive a benefit by consuming phytonutrients. So if you remember in the previous slides, one of the secondary cascade effects of brain injury is oxidative stress. So consuming foods known to have antioxidant behaviors can have a significant impact. Before we get into diet recommendations or eating plan recommendations for brain health, I want to quickly tell you what some of the research into brain health shows. In preparation for today's webinar, I came across a few interesting review articles pertaining to brain health and supplements of vitamins, minerals, or phytonutrients. Many of these were animal studies and some were human studies, but all require a bit more research to define specific dosing. So I know this slide may seem very busy, but I thought since this webinar is being recorded, you may have the opportunity to go back and take a look at this slide in more detail. So some of the nutrients of interest in science and in research include omega-3 fatty acids and vitamin E, and I'm going to spend a little more time talking about those in the coming slides. But the other vitamins and minerals and phytonutrients that were being looked at sort of individually are vitamin D, zinc, magnesium, curcumin, sulforaphane, resveratrol, melatonin, choline, and enzogenol. So some of these nutrients have been shown to reduce inflammation, reduce oxidative stress, act as antioxidants, or promote good sleeping patterns or improve cognition. So right now there's no recommendation to consume any of these nutrients as a standalone or as an oral supplement. Just as a side note, you always want to check with your physician before you take anything or trial anything over the counter. But right now, there's no specific guideline to take any of these for brain injury itself. But the good news is that today I'm going to share with you how you can incorporate all of these vitamins and minerals and phytonutrients into your daily eating plan. So omega-3 fatty acid and brain health. Omega-3 fatty acid is a long-chain polyunsaturated fatty acid. It's typically found in high concentrations in algae and fish. It's considered essential because it cannot be synthesized by the body and must come from our food. There are different types of omega-3 fatty acids. So eicosapentaenoic acid, which is EPA, is a type of omega-3 fatty acid which plays an important functional role in the body, but the concentration of EPA in the brain is somewhat negligible. So the omega-3 fatty acid that is most discussed and most researched is docosahexaenoic acid, which is DHA, and that's a type of omega-3 fatty acid that is found in the brain. So DHA has an important structural role in the brain. Like I said, it supports brain development and cognitive function throughout the lifespan. And evidence does suggest that DHA may act as a promising recovery aid from mild traumatic brain injury. So again, supplementation of DHA is a standalone. The therapeutic efficacy of it is still, we need to determine dosing for it. But you can get this in the foods that you eat, and that's what I'm going to share with you. Good sources of omega-3. So we always hear about fatty fish and omega-3, and I've included on this slide a good list of fish that are good sources of omega-3. So you can see here albacore tuna, salmon, Atlantic herring, anchovy, sardines, Atlantic mackerel, mussels, which are a shellfish, and algae. So you can also consume edible seaweed versions, which can provide omega-3. I've also listed the foods that you would want to avoid, or the fish that you'd want to avoid, because these, on the right-hand side, these fish tend to be high in methylmercury: swordfish, shark, tilefish, king mackerel, and marlin. And methylmercury can affect brain and nervous tissue. So it's best to avoid these fish on this list and really stick with the ones under the thumbs up list, getting 2 to 3 servings of these types of fish a week. There are also some non-fish omega-3 sources. listed here on this slide. You can see chia seeds, hemp seeds, flax seeds, edamame, soybean oil, walnuts, and kidney beans. But these sources are not the best as a sole source of omega-3, and that's because the type of fatty acid that's found in these plant foods has to be converted to a form of EPA or DHA, and our body's ability to convert this is limited. So while these foods they do have plenty of health benefits on their own, and I would say they should be incorporated into your general eating pattern, you don't want to rely on them as your sole source of intake for omega-3 fatty acids. So let's talk a little bit about vitamin E and brain health. Vitamin E is a fat-soluble vitamin. It's a potent antioxidant as it's able to cooperate with a network of endogenous and exogenous antioxidant sources. It helps to stop oxidative damage. It's a peroxyl radical scavenger, which protects cells from damage caused by free radicals, and it helps to protect that phospholipid membrane from breakdown. So we need more human studies regarding supplementation of vitamin E in greater amounts than what's generally recommended for our daily population. In adults, our daily recommendation is 15 milligrams per day, which you can easily get in the foods that you're consuming. There have been some animal studies on vitamin E and vitamin C, which is also an antioxidant in combination, and they may show some benefit, but more studies need to be done in order to recommend a particular dosing. And good sources of vitamin E that you can incorporate into your daily eating pattern are plant seeds like sunflower seeds, sesame seeds, pumpkin, flax seeds, different types of nuts, peanuts, and different vegetable oils. So before we move into different diets or eating plans which promote brain health, I just want to share with you some food sources of nutrients that are being studied for supplementation. So this is based on our previous slides when I shared what the current research is. So you can see here vitamin D. You can find vitamin D in the fatty fish, beef liver, cheese, egg yolks, and fortified foods. Zinc is a mineral that can be found in meat, shellfish, legumes, beans, seeds, nuts, dairy, eggs, whole grains. Magnesium is another mineral, and I've listed here. It's green leafy vegetables, fruits, nuts, and seeds. And then additionally, I mentioned curcumin, which is an ingredient in turmeric, which you can use to like spice your food. Sulforaphane, which is found in cruciferous vegetables like broccoli. Resveratrol, it's found in the skin of berries and grapes. It's also found in peanuts. And choline, which is considered an essential nutrient, can be found in eggs, liver, and peanuts, and it's mainly found in animal-based food sources. So let's get into different eating plans and different diets that can help benefit brain health. The first one I want to talk about is the Mediterranean eating plan. The origin of the Mediterranean diet is from a 7-country study by Ansel Keys. It was conducted over 50 years ago, which determined, it looked at men in around 7 different countries. And what the studies found was that around the Mediterranean Sea area, there was a lower coronary heart risk. And so they started looking at the eating patterns of the men that lived in that region. And over time, we've really looked at the Mediterranean eating plan and how it relates to different disease states. So the Mediterranean eating plan is well known for cardiovascular and anti-inflammatory, providing anti-inflammatory benefits. It's associated with healthy aging, with a reduced risk of certain cancers, reduced risk of complications from type 2 diabetes and Parkinson's disease. And now there's new research to suggest that this healthful eating pattern can also protect against brain health and cognitive performance. And just this week, CNN had a story on the Mediterranean diet and brain health. So it's definitely in the news as it pertains to brain health. The Mediterranean eating plan